The good news? You're likely to start feeling better soon. Morning sickness often goes away after you enter the second trimester. Keep in mind, some moms-to-be experience a more severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, call your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained much weight, and you may even have lost a little if you've been dealing with morning sickness. Be sure to talk to your doctor if you're concerned. Exhaustion. You might feel like napping at every opportunity. This could be thanks to the increased levels of the hormone progesterone in your body. Headaches. Some moms-to-be get the occasional headache during pregnancy. If you're experiencing this symptom, try to rest in a darkened room and apply an ice pack to your head or neck to help relieve the pain. Contact your healthcare provider if the headache persists or is severe. Mood swings. Hormonal changes may play a role in the highs and lows you feel when you're about 10 weeks pregnant. You may find it helpful to distract yourself by chatting with friends, watching funny TV shows or movies, or treating yourself to a massage. Just be sure to choose a trained masseuse who knows about safe massage techniques for pregnant women. Vaginal discharge. You might be seeing more vaginal discharge than before, which is caused by your increased blood supply and higher hormone levels. This normal vaginal discharge is known as leukorrhea, and you can expect to see a clear to milky colored, nearly odorless discharge that may appear slightly yellowish on your underwear. Contact your healthcare provider, though, if you notice a strong odor or color changes, or if you experience itching or bleeding around the area. Acne. If you're experiencing and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. And remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
Start with a warm welcome and a brief introduction to the topic. Mention the importance of understanding ovulation for those trying to conceive or practicing contraception. Point 1. Know your menstrual cycle. Explain that ovulation occurs in the middle of your menstrual cycle. Discuss the typical menstrual cycle length, which is days, but can vary. Emphasize that tracking your cycle is essential. Point 2. Start with day 1. Explain that the first day of your menstrual bleeding is considered day 1 of your cycle. Point 3. Calculate your cycle length. Instruct viewers to record the number of days between the start of one period to the start of the next for a few months. Highlight that cycle length can vary and may not always be the same. Point 4. Determine your ovulation window. Mention that the ovulation window is usually around the midpoint of the cycle. To find it, subtract 14 from your average cycle length. For example, if your cycle is 28 days, subtract 14 to get 14. Your ovulation window is around day 14. Point 5. Use ovulation prediction kits. OPKs. Explain that OPKs can help pinpoint ovulation more accurately. Describe how to use OPKs by following the package instructions. Point 6. Monitor basal body temperature. BBT. Discuss how a woman's basal body temperature rises slightly after ovulation. Instruct viewers to use a basal thermometer and take their temperature every morning before getting out of bed. Point 7. Track cervical mucus changes. Explain that cervical mucus changes in consistency throughout the menstrual cycle. Describe how to observe and record these changes. Point 8. Pay attention to ovulation symptoms. Mention common symptoms like mild pelvic pain, breast tenderness, or heightened senses. Stress that these symptoms are not definitive but can be additional indicators. Point 9. Keep an ovulation calendar. Encourage viewers to create an ovulation calendar. Use a calendar or a smartphone app to track cycle length, OPK results, BBT, and other relevant data. Point 10. Be patient. Remind viewers that it may take a few months of tracking to accurately predict ovulation. Highlight the importance of patience and persistence. Conclusion. Summarize the key points discussed in the video. Remind viewers that understanding their ovulation cycle can be helpful whether they are trying to conceive or manage contraception. End with a call to action, encourage viewers to subscribe, like, and share the video. Invite them to ask questions or share their experiences in the comments section.
11 weeks pregnant, your baby's development. From an oversized head to tiny tooth buds, this week is full of exciting growth and changes, both big and small. Your baby's facial features are slowly maturing, with the ears now moving toward their final position on the sides of the head, and the eyes set wide apart with eyelids fused shut. Genitals are forming too, although it's still too early for your healthcare provider to tell if you're having a girl or a boy. But even though you don't know your baby's gender yet, why not start a list of your favorite baby names for boys and girls? Have some fun with our baby name generator. You still have plenty of time to browse and find a name you love. Tiny buds that will eventually become teeth are developing. The head makes up half the total body length at this stage, although in the coming weeks the body will grow significantly too. To support all this growing, your baby now needs more nutrients, so the placenta grows, and its red blood cells increase in number to meet this need. The size of the fetus at 11 weeks pregnant. At 11 weeks, the fetus is about the size of a Brussels sprout. From crown to rump, the average length is now 2 inches, and the average fetus weighs just about 0.33 ounce. Mom's body at 11 weeks pregnant. Are you having unusual food cravings this week? They're quite common, between 50 and 90% of women experience these cravings at some point during pregnancy. No one knows for sure why pregnancy cravings occur. Some medical experts believe these cravings are your body's way of telling you what it needs, while others blame them on changing hormone levels. As long as your food choices are part of a healthy pregnancy diet, go ahead and eat up. There is a type of craving that needs medical attention, like clay or dirt. Contact your healthcare provider. 11 weeks pregnant, your symptoms. At 11 weeks pregnant, here are some of the symptoms you may be experiencing. Breast growth. Your breasts may be a little larger now, and you can expect to see even more growth as your pregnancy progresses. Some of this may be because the milk glands grow in preparation for breastfeeding. You might gain up to 3 pounds of breast tissue over the course of your pregnancy. Increased vaginal discharge. Your body may be releasing more clear vaginal discharge now. This is normal as long as it is odorless and clear or white in color. If you notice changes including blood, itchiness, or a foul odor, contact your healthcare provider to out problems. Dark abdominal line. You might notice you have developed a long, dark line that runs vertically down the center of your belly. It's called the linea nigra, or the pregnancy line, and it's thought to be associated with hormonal changes. This line will likely fade after your baby's birth. Leg cramps. You may be troubled by tight, painful leg cramps, particularly at night. This can make it tough to get a good night's rest. Stretching can help with leg cramps, as can exercise. In some cases, mineral depletion may contribute to having leg cramps, so make sure that your diet is giving you enough calcium and magnesium, and take care to stay hydrated. Fatigue. Right now, your levels of the pregnancy hormone progesterone are increasing, which can sometimes make you sleepy when you'd rather be alert. And, if you've been waking to pee or having leg cramps or getting heartburn during the night, your sleep may be suffering too. Eliminating caffeine and following a relaxing bedtime ritual every evening can help fight pregnancy fatigue. Mood swings. You can thank your heightened hormone levels if you've been experiencing mood swings or moodiness lately. Try to avoid stress, and ensure you're getting enough iron in your diet. Practicing yoga, doing simple meditations, or relaxing while listening to soft music might help you feel a little better. You could also ask your healthcare provider for advice on dealing with your mood swings, particularly if they're interfering with your daily life. Morning sickness. Experience queasiness and even vomiting at 11 weeks pregnant, and this can occur at any time of day. Morning sickness often subsides in the second trimester, though, and you're almost there. Baby development at 12 weeks. Your baby is about the size of a lime. Length: 2.13 inches. Weight: 2.05 ounces.
Small movements. This week, your baby can open and close their hands, making a fist, and curl their toes. Tiny fingernails. Your baby has itsy bitsy nails growing on their fingers and toes. Your baby's intestines. The stomach and esophagus started forming around 7 weeks of pregnancy, and your baby's intestines grew so fast that they protruded into the umbilical cord. Soon, the abdominal wall will close and their intestines will make their way inside their abdomen. Your baby, although tiny, is now fully formed. They are about the size of a plum. The placenta is also now fully formed, although it will keep growing throughout your pregnancy. The placenta is your baby's life support system, passing oxygen, nutrients and antibodies from your blood supply to your baby. From now on, your baby is going to grow. Even though you can't feel it yet, your baby is moving, waving and dancing. They can also swallow. Your 12-week fetus is almost done developing their body's important systems and parts, which means it's all about getting bigger and more mature from here on out. Yep, baby's about to enter the growth and maturation stage, in which organs and tissues will grow and develop rapidly. Baby at 12 weeks is opening and closing their fingers and curling their toes, and their brain is developing fast. Baby is now developing reflexes. If you poke your 12-week pregnant belly while looking at baby on an ultrasound, you'll likely see movement. If you're 12 weeks pregnant with twins, your twosome is developing at a similar rate as singleton babies at 12 weeks. Later on, they'll have a slightly slower rate of growth. Early pregnancy symptoms, at 12 weeks. Your signs of pregnancy may include an aching stomach, nausea, mood swings, a metallic taste in your mouth, sore breasts, indigestion and heartburn, headaches, dizziness, new likes and dislikes for food and drink, a heightened sense of smell, a white milky pregnancy discharge from your vagina, light spotting, see your doctor if you get bleeding in pregnancy, cramping, a bit like period pains, darkened skin on your face or brown patches, this is known as chloasma or the mask of pregnancy, greasier, spotty skin, thicker and shinier hair, bloating and the feeling of being bloated.
14 weeks pregnant. Your baby's development. Welcome to your second trimester. Your little one is trying out some new moves this week. Your baby's eyes are starting to move, and those little legs and arms are starting to flex. These movements also allow your baby to practice the important skill of moving hands to mouth. The senses of smell and taste are also developing, and your baby's skin is thickening too. You'll have to wait and see if your baby will be born with a full head of hair or not, but right now, hair follicles are forming under the surface of the skin. With each passing week, your baby is looking more and more like the little person you'll meet the day you give birth. By now, or very soon, the genitals are fully developed. But it's still too early to know whether you're having a boy or a girl. How big is my baby at 14 weeks? At 14 weeks, your baby is growing and developing rapidly, measuring between 3.5 and 4 inches long and weighing around 2 ounces, about the size of a navel orange. The size of the fetus at 14 weeks pregnant. At 14 weeks, the fetus is roughly the size of a nectarine. Around this time, the average fetus weighs about 1.5 ounces and can measure up to 3.5 inches long, crown to rump. Making faces. Thanks to brain impulses, your baby's facial muscles are getting a workout. Those tiny features can squint, frown, and grimace. Your baby is also making sucking and chewing movements. Growing hair. Soft baby hair is coming. Hair follicles have started to form deep in your baby's skin. Around 20 weeks, fine downy hair will sprout from these follicles on your baby's eyebrows, upper lip, and chin. Your active baby. Though you can't feel those tiny punches and kicks yet, your baby is quite active and has flexible hands and feet. Mom's body at 14 weeks pregnant. You've finally reached the second trimester. Pregnancy symptoms during week 14. No more morning sickness? Your energy is likely returning, and your queasiness may have eased by now. If not, hang on, chances are good that morning sickness will soon be behind you if it's not already. Although it's uncommon, some expecting moms will still feel nauseated months from now. Tell your healthcare provider at your next appointment if you're still having nausea or vomiting. Starting to show. The top of your uterus is a bit above your pubic bone, which may be enough to put ill, giving you and your partner visible evidence of the baby you're waiting for. Bleeding gums. About half of pregnant women have swollen, red, tender gums that bleed when flossed or brushed. This gum inflammation, called pregnancy gingivitis, is partly caused by hormonal changes that make your gums more sensitive to the bacteria in plaque. Be sure to brush your teeth twice daily, and floss daily. Round ligament pain. On either side of your uterus, you have 2 ligaments that stretch and thicken to accommodate your growing belly. These changes may cause round ligament pain. It can feel like a short, stabbing pain in response to movement, or a dull ache after an especially active day. If round ligament pain strikes, try to stop and rest, pay attention to your posture, change positions, gently massage the area, or take a warm bath. Some women find that wearing a maternity belt for extra support helps relieve the pain. Increased appetite. Pregnancy hunger starts and peaks in the second trimester. Your body is working hard to support your baby, and that requires plenty of energy. Your meals are also fueling your body's pregnancy changes, which include a much higher blood volume, your growing breasts and uterus, and increased fat stores. You need an extra 300 to 350 calories per day in the second trimester. Round ligament pain. For some women, a possible side effect of uterine growth is what your OB/GYN would call round ligament pain. Basically, these are pregnancy growing pains that feel like achy or sharp pains on one or both sides of the abdomen. That begin to appear around 14 weeks but can strike at any time during the second trimester. Here's why. The uterus is supported by thick bands of ligaments that run from the groin up the side of the abdomen. As your uterus grows, the supporting ligaments stretch and thin out to accommodate the increasing weight. This weight pulls on the ligaments and causes a sharp pain or a dull ache in your lower abdomen. It's often more noticeable when you change positions suddenly or quickly get up from sitting or lying down, or when you cough or sneeze. The best way to bring relief? Put your feet up and rest in a comfortable position, which should ease the strain and the pain. Baby development at 15 weeks. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange. It measures around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of 1 chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has already formed all its vital organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe outside your womb. She is actively drawing in amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby doesn't actually taste what you're eating, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms.